Hello and welcome to the Arise interview, 60 glorious minutes of multifaceted discussion where we speak to the newsmakers as well as ordinary people doing extraordinary things, and we feature the voices at the heart of the stories. I'm Charles Aniagolu. Coming up in the next hour, the practice of defecating in open places has long been blamed for the spread of disease. It also puts women's safety at risk when they go out under cover of darkness to relieve themselves. As the world marks Toilet Day this week, Nigeria's President Muhammadu Buhari has committed Nigeria to being open defecation free by 2025. But in a country that's ranked second amongst the nations in the world with the highest number of people practicing open defecation and where many places lack running water, can the president pull it off? We'll speak to two experts from WaterAid. Move of Nigeria's closure of its land borders to tackle smuggling brings bustling trade to a standstill, with goods rotting and queues of lorries waiting at checkpoints. We assess the impact of the closure on regional trade and the anger it's drawing from Nigeria's neighbors, whose economies have been badly hit by the crisis. All in a moment. Now let's begin with a subject that seems pretty basic but is hugely important to everyone. Human waste, relieving oneself. It's something that you and I may take for granted because where we are, there is a water system toilet. But imagine if you don't have one because there is no running water or sewage system where you live. Now, millions of households in Nigeria and across the world do not have access to lavatories and are having to go to toilet in the open. And in places where there are water system toilets, many of them are not being used for a variety of reasons, including lack of running water, poor maintenance, and deeply ingrained cultural habits. The result is defecation in open places, such as fields, waste grounds, and in rivers, which leads to the spread of disease. In Nigeria, for instance, an estimated 87,000 children die from diarrhea every year, according to the World Bank. So President Buhari has committed Nigeria to being free of open defecation by 2025. He set up the Clean Nigeria Campaign Secretariat, which will ensure that all public places have accessible toilets within their premises. But what about rural areas and places where there is no running water? Well, in a moment, we'll speak to two experts from the international NGO WaterAid about all that. But first, here's a WaterAid video illustrating the scope and scale of the problem.
Healthy, happy and vibrant children, the joy of every parent, the pride of every growing society and the hope of every nation. But what happens to a nation when the health and well-being of its future leaders is on a fast and steady decline due to preventable diseases from dirty water, poor sanitation and hygiene? While clean water, decent toilets and good hygiene practices are essential for the survival and development of children, the latest Nigerian WASH National Outcome Routine Mapping Survey shows that around 100,000 children under the age of 5 in Nigeria die from diseases caused by the nation's poor levels of access to water, sanitation and hygiene. Sadly, Nigeria's children are not the only ones affected by a lack of access to these basic services. 112 million people, a staggering 58.5% of the country's population, do not have basic sanitation. 78.8%, 151.6 million people, do not have access to basic hygiene facilities, and 47 million, which is 24.4% of the population, practice open defecation. While the indices for clean water supply are significantly better than those of sanitation, 26.6% of Nigeria's population, 51 million people, still lack access to clean water. Nigeria missed the 2015 Millennium Development Goal sanitation target, and access to improved sanitation in the country decreased by 9% over the 25-year period of the MDGs. Access to piped water service, which was at 32% in 1990, is now less than 10%, and currently 38% of all improved water points and around 46% of all water schemes are non-functional.
Well, that's a short video there from the international NGO WaterAid. So as we mark World Toilet Day this week, let's speak now to two senior staff from WaterAid. Olga Ghazaryan is the Director of International Programs for WaterAid UK, and Dr. Chichi Okoye is the Country Director for WaterAid Nigeria, and they both join me now in the studio. Thank you very much indeed for coming in. I'll start with you. You're sitting closer to me. Just shed more light for us, if you will, on the problem of the lack of toilets around the world. It is a big problem, isn't it?
It is an enormous problem.
Right.
November 19th is the World Toilet Day. And talking about toilets is not glamorous. It's not a vote winner. It has a lot of stigma attached to it, so I'm very happy to talk about it.
I was going to say, please don't have your dinner while the program is going out.
Yeah. And if you look at the global progress, every single nation in the world committed to Sustainable Development Goal 6, and the bit on sanitation there is to eliminate open defecation by 2030 and to make sure that every household in the world has a safe toilet that they do not share with other households, and that human waste is safely managed. And where are we on progress on that? Excuse me. Unfortunately, we are off track. Only about 40 countries out of 152 countries are on track to achieve that goal. So what needs to be done? So there are 700 million people that defecate in the open.
That's globally.
Globally, yeah.
Right.
Not in Nigeria, it's 47 million people. And if we continue what we are doing now, we will achieve universal access to sanitation in the middle of the next century. So business as usual is not an option. The good news is that we see progress in many states. We have seen progress in India, for example, in the last 5 years. The initiative, Swachh Bharat initiative, has triggered a huge dent in open defecation. About more than 500 million people are open defecation
Right,
free
but there
now.
are big issues because a lot of research has been done on that. I'll talk about India a little bit later, but let me bring you in, Dr. Okoye, there, because I suppose that because of this lack of proper toilets, let's talk about Nigeria, for instance. You're the country director of WaterAid. Many communities in this country are almost overrun by fecal matter. I was watching your video there. I was absolutely shocked.
Yes, I think the reality is that Nigeria missed the MDG goals, Millennium Development Goals, and we are not on track for the SDG goal, except we do something drastic. 47 million people openly defecating is more than several countries put together. So that's a huge population, and like you said already, a lot of the issues that we face in health can actually be addressed through sanitation. Some of the epidemics that we have had in cholera, typhoid, many of the diseases that children face are things that can be addressed through better sanitation. So the country can actually be saving a lot of money on healthcare if we focus on the prevention, which is sanitation. Unfortunately, that's not happening, and that's why we're really very excited about the president launching the sanitation campaign. The Nigerian president launched the sanitation campaign. It's called the Clean Nigeria campaign, Use a Toilet. And for the first time, the Nigerian government has prioritized water and sanitation, and especially sanitation now. And the desire and the hope is that so many state governments and local governments will come behind this campaign. Most times what we are used to is government denying the statistics and trying to pretend that it's better than it is, but the Nigerian government has owned up to it and is now doing something about it, and we're very excited about that, and organizations such as ours are really very, poised to support the government in actualizing this goal.
Right. We'll talk more about what the Nigerians are doing and how effective it can be. But just to return to you, Olga, you were talking about giving us the figures globally about sort of people who have access to toilets, functioning toilets and that sort of thing. Where is it worst in the world?
It was...
I mean, Nigeria,
yes,
obviously, because
yeah.
I understand Nigeria is the second worst in
yes,
the world.
Yeah.
And which is the first?
India was
India
the
is
first.
still the first, right.
It's not still the first.
Okay,
it
right.
was the first. And I think it is really important to acknowledge...
So sorry to interrupt you.
Yeah.
Does that mean Nigeria is now the worst?
Seems
because if
to
it
be.
was second,
Yeah, it
and
seems to
India
be.
is no longer
Yeah.
the first, so
It
Nigeria
seems
is
to
not
be.
right.
It seems to be, because the demographic growth in
Right.
Nigeria outstrips the investment in water and sanitation. But coming back to India, I think the enormity of the ambition and the personal political commitment to address open defecation for more than 527 million people is an amazing initiative. And of course there are issues. It is always extremely difficult to achieve sanitation for the most marginalized people, who are marginalized on caste, on race, in the geographically remote areas. So of course there are issues there. And however, the construction of 110 million toilets, the addressing of a lot of soft issues such as hygiene behavior change has put India in a position that it has inspired a lot of other countries.
Well, it certainly inspired Nigeria.
To make an example. So I think that shouldn't be underestimated.
Right, and of course, Dr. Okoye, there is a much broader issue. I think your video pointed that out, and you hinted at that at the outset, which is a lack of proper sanitation that includes not just access to toilets, but clean water as well.
Indeed. We're doing better on water, of course. A lot of people, you can't live without water, so there's more effort. But still, it's only 68% of Nigerians who have access to clean water. Even the people who have access to water, people who have their own private boreholes, who think that they have access to water, don't know what the quality of the water is really. And so it's also a challenge in terms of providing water. At WaterAid, we say that the best water is pipe-borne water, from government services, because then you're sure that it's treated and the quality is good. But less than 10% of Nigerians have access to that type of water. So we recognize, of course, that you can't talk about sanitation without water. But but we also recognize that some people could have water and it doesn't automatically translate into good sanitation. So you have to address both of them at the same time, improving water, but at the same time also ensuring that people's sanitation, is improved. So we can't do one and not the other.
Right. And are you impressed with what you've seen? I mean, I know you said that it's a good first step, but just very briefly, are you impressed with what the Nigerians have done? Because of course, it's one thing to just talk about toilets. I mean, you've got to have water and all of that to make those toilets function.
I think what I've seen in the recent months is a political commitment and political prioritization.
Right. So you're seeing a political will.
Yeah.
Okay, let me ask you to hold that thought. We'll continue chatting in a moment. You're watching the Arise interview. Plenty more still ahead as we continue our chat about World Toilet Day and efforts to improve sanitation in Nigeria and around the world. Stay with us. Welcome back to the Arise interview, where we speak to the newsmakers as well as ordinary people doing extraordinary things around the world and featuring the voices at the heart of the stories. I'm Charles Aniagolu. Now, as you may have heard, Nigeria is following in the footsteps of India, which pledged in 2014 that it would end open defecation. President Buhari has pledged that all public places, including schools, hospitals, hotels, petrol stations, places of worship, markets and offices will have accessible toilets in their premises by 2025. Nearly 50 million people across Nigeria don't have access to proper toilets. The country is now ranked second amongst the nations in the world with the highest number of people practicing open defecation. It could now, in fact, be the first. Thousands of people, many of them children, die every day because of poor sanitation resulting from the lack of toilets. We'll talk some more about all that in a moment. But first, here's another video courtesy of WaterAid, where the Nigerian government is setting out its action plan for solving the problem of open defecation.
There's still a long way to go to get 47 million people across 759 local government areas to stop open defecation and begin to use improved latrines. To accomplish this task, President Muhammadu Buhari declared a state of emergency in Nigeria's water, sanitation and hygiene sector in April 2018, formally launching it on the 8th of November of the same year with a national action plan to revitalize Nigeria's wash sector.
Henceforth, federal government support to state governments will be based on their commitment to implement the national water supply, sanitation and action plan in their respective states and to end open defecation by 2025.
To translate these plans to real action and achieve open defecation-free status before 2025, Nigeria is emulating a model proven to be potent by India, which demonstrates that it is possible to change attitudes and facilitate access to sanitation facilities and hygienic practices.
Clean Nigeria, use the toilet.
The Clean Nigeria Use the Toilet campaign is an innovative intervention anchored by the Federal Ministry of Water Resources aimed at bringing an end to open defecation in Nigeria by 2025.
And that's a video provided to us courtesy of WaterAid. Still with me in the studio as we mark World Toilet Day this week, two senior staff from WaterAid. Olga Ghazaryan is the Director of International Programs for WaterAid UK, and Dr. Chichi Okoye is the Country Director for WaterAid Nigeria. Thank you very much indeed for staying with us. I was speaking to you the last time, so I'll let you finish. You were talking about places where it's worst in the world, political will and that sort of thing, and how Nigeria appears to be exhibiting that political will.
I think it is very impressive that water and sanitation and hygiene, and especially sanitation, are prioritized at the highest political level and elevated to that agenda. That's one of the first and most important preconditions. Political will, of course, doesn't mean just proclamations. It means adequate financing. It means monitoring progress and making course correction when things don't go right. And it also means a lot of sector coordination between different stakeholders in the country. And
Dr. Okoye, I mean, as she said, there are many governments that are clearly not making this a priority. Issues around sanitation are progressing very slowly, perhaps too slowly for your comfort?
I think it comes from the fact that the government has not really seen the opportunity. I know that this government, and many state governments are interested in job creation, interested, in improving, their budgets, and they don't see sanitation as contributing to that. And it's not really something that they go around people asking them during the campaigns. Most people are also not thinking about sanitation. But if you look at the huge opportunities that are available in sanitation, there are 47 million people who don't have access to toilet. That's 47 million people who need toilets. That's a huge business opportunity. And I think that if the government begins to think about sanitation, from a wealth creation perspective, that they will start prioritizing it a little bit more.
Obviously, they've got to find the money to build toilets.
No, the individuals, the government can never build toilets for
Right.
people. But if you provide the enabling environment and provide incentives, there are actually a lot of toilets that are affordable. The thing is that most people don't know that they exist. And I do agree that there is the poorest of the poor who may not be able to afford that. And then those are, but it's always a small, minority. And then we can provide grants for providing those facilities. But if you look at the whole value chain, even the containment and the end product from waste, you can produce biogas, you can produce fertilizer. Nigeria spends billions importing fertilizer. Meanwhile, we have human waste that can be used for that. It can be used for briquettes so that we cut down less trees. So there's a lot that we can do. And I think that one of the things that we're trying to do is to open the eyes, especially at the state level, because I think they get it at the federal level, to say, it's not just about providing sanitation. That's important on its own. But as an extra incentive, you can create a whole economic value chain along
That's an
the
interesting
sanitation.
proposition. And Olga, the beyond governments, because we talk a lot about governments, she did mention the fact that citizens should also be involved. Is there enough concern from citizens? Because I've read that part of the reason why people don't often use proper toilets, even in some areas, for instance in India, where they've been built, they're available, are as a result of deeply ingrained cultural habits.
Well, that's absolutely right, that sanitation is ingrained in deeply, as you said, held cultural values and practices. That's why building toilets is not enough. Building an infrastructure is not enough. And it is important not to repeat the same mistakes in Nigeria, for example, where population needs to be triggered, where proper information campaigns need to be launched, where people need to know that a toilet is not just a toilet, but it has a lot to do with people's health, education, nutrition, safety and dignity.
I think I would agree with you, because I actually remember this driver that drove me around for a while, and he'd driven me. I was filming something to Enugu, and then I came out in the morning. I was looking for him. We'd put him up in a hotel with water system, toilet and everything, and we rang him, and eventually he emerged from somewhere and said, well, where have you been? He said, I went to the bush. I'm like, what on earth are you doing in the bush? You're in a hotel with a water system toilet. He says, I'm not interested in that. I prefer the bush.
Yes.
So that's quite extraordinary, isn't it? I mean,
Yeah, it is. So education campaigns, preparation, hygiene behavior change, and a lot of other aspects need to be in place before the infrastructure is built. But also after that, when you build an infrastructure, there also needs to be a safely managed disposal, because when the toilets get full, then people stop using them. So it's a whole value chain.
yes, absolutely. So there's got to be water and all that sort of thing to
Absolutely.
run it. I mean,
Yeah.
make sure and that's always a problem, because I mean, there are toilets, even at universities. I mean, you go into the places and they're completely unusable, which forces the students to go to the bush. But I mean, given the challenges, Dr. Okoye, faced by Nigeria, including the lack of water in many communities, is the target of 2025 realistic?
Yes and no. Yes, in the sense that if it is something that Nigeria prioritizes, it is possible. No, that if we continue the way we are going, it will not be. But I'm very optimistic, because if we look at what we had done with polio, and how all the actors came together, and how the government really put not just political statements, but political action behind it. Now, I mean, we could have declared ourselves polio-free last year, if not for the 1 or 2 people that was identified. I mean, and if you think about where we're coming from in terms of polio, so when we are serious.
Nevertheless, polio was global action, though. It
Well,
wasn't.
this is a
It wasn't
global
just
action. This is
dependent on the Nigerian government.
No, but I think it's the same thing, with this, because the SDG 6 is
Right.
a global call to action, and a lot of countries are committed to supporting Nigeria. Of course, Nigeria has to be on the driving seats; they have to be the ones, pushing. But the point I'm making is that even with polio, if the Nigerian government had not shown the type of commitment that it did, all the global actors would not have been able to make the difference actions that they did. So I think for me, the important thing is, first of all, for the government to believe that this is possible and to put the actions in place and to follow up with those actions and to have the behavior change communication aspect of it. Because like Olga said, it's not just about building toilets. It's about making sure that people use those toilets, you know, and maintain them.
Sure.
And I think that this is something that I think a lot of people understand, that they want to use the toilet. It's just that they haven't had the culture and the practice of doing it. It's not something new that you're introducing to them. And so I think that if we get all the actors together and the government shows the political will, I believe that we might not get everyone by 2025, but at least we will have, you know,
You've made a giant leap forward.
Indeed.
Okay. We haven't got. We've got about a minute and a half or so left. This week, the world is marking World Toilet Day. What does that entail?
It entails take a pause, look at the progress we have made so far, and think about how we need to significantly accelerate the progress, doing things very differently.
Well, tell us more about that. I mean, because, I mean, well, it's part of an education process, I suppose, or program. Therefore, it's important for people to know what is actually involved. You see what I mean?
Yes.
I mean, what is it setting out to achieve, basically?
What it is setting out to achieve is that every single household in the world has a toilet that is clean and safe, not shared with any other household, and where human waste is safely disposed. It also means that globally, the open defecation will be eliminated. And three things need to happen for that to work. Firstly, it requires political will and prioritization from the governments. Secondly, it needs a properly functioning sector. And the sector is not only the government. The business sector, the civil society organizations need to come together and work together to achieve that. And thirdly, and which is very important, is empowered citizens that change their own behaviors,
Right.
but also hold their governments to account
Okay.
to fulfill the pledges they made.
Okay, Olga Ghazaryan and Dr. Chichi Okoye, both from WaterAid, thank you very much indeed.
Thank you.
You're watching the Arise interview, plenty more still ahead, including we assess the impact of the closure of Nigeria's land borders on regional trade and the anger it's drawing from the country's neighbors whose economies have been badly hit by the crisis. Stay with us.